Mesdames et messieurs, bonjour et bienvenue au 13h sur Canal 2 International. Henri Kédian, good day.
Yeah, good day, Junior Hussein. Good day and welcome to join us on this edition of the Bilingual News on Canal 2 International. We begin with our top stories. Well, WHO Chief Scribe Dr. Tedros Ghebreyesus pessimistic vaccines are a vital and powerful tool to prevent the coronavirus pandemic, adding the world has witnessed rising cases of infections and death. Tedros Ghebreyesus is on 1 p.m. News Today.
Début ce mardi 13 avril 2021 du jeûne du Ramadan au Cameroun et dans le monde justement, de nombreux fidèles musulmans vont devoir se plier aux exigences de la Covid-19 pour honorer ce rendez-vous religieux. On en parle dans ce 13h.
And Cameroonian students on strike in Algeria over non-payment of scholarship allowances for over 3 years. You have details in this edition of the newscast. Well, those were our top stories. The news is just right ahead in a split second. Well, thanks and welcome to join us on this edition of the news. I'm Kejang Henry Atimbe and Junior Hussein, and you can watch us on our YouTube page and on our Facebook page. Well, Junior, you start the first part of this news with another death that has shaken the country, that of Professor Lazare Kaptue.
Et on en parle justement en ouverture de ce journal, disparition ce jour d'une des grandes figures de la médecine et de l'enseignement de la médecine au Cameroun, le professeur Lazare Kaptue s'est éteint hier soir à Yaoundé, disons-le ainsi, dans sa propre clinique établie au quartier Bastos. La communauté médicale et université évoque avec douleur le décès d'un pilier de la médecine dans la sous-région. Âgé de 82 ans, Lazare Kaptue était agrégé d'hématologie, immunologie et de maladies du sang. Il aura eu une très riche et longue carrière administrative et académique au Cameroun, au Centre universitaire des sciences de la santé, puis fondateur de l'Université des montagnes à Baganté. Et en restant en santé, 43 660 doses de vaccins Sinopharm pour la région du centre sur les 200 000 doses offertes au Cameroun par la Chine. Le reste sera reparti dans les hôpitaux des districts du pays. L'injection des premières doses a démarré avec le corps médical classé parmi les cibles prioritaires définies par le conseil scientifique pour, n'est-ce pas, prêcher par le bon exemple. Manaouda Malachi, ministre de la Santé publique au Cameroun, a ouvert le bal. Karim Ezachachoya et Michel Foucault.
Le patron de la santé publique donne le ton et reçoit son carnet de vaccination. À sa suite, les soldats au front contre la pandémie coronavirus depuis plus d'1 an. Ça se passe à l'esplanade du centre spécialisé de prise en charge des patients victimes de Covid-19 d'Orca à Yaoundé. Les sujets après cette première dose doivent en principe se faire administrer la deuxième dose dans 21 jours. Le mécanisme ici enclenché fait du 12 avril une date mémorable pour le Cameroun.
Ici que c'est un très grand jour pour la riposte camerounaise et notamment pour le personnel de santé. Et c'est pourquoi nous tenons à remercier du fond du cœur Monsieur le Président de la République qui a permis que tout ceci arrive. Et l'objectif premier, c'est la prévention et la préservation de ce personnel de santé qui est au front depuis bientôt déjà 1 an.
Des munitions en plus dans cette bataille que mène le Cameroun depuis le 6 mars 2020 contre la Covid-19. La pandémie qui a déjà atteint 57 337 personnes et tué 851 fils et filles du terroir selon les statistiques officielles récentes, n'a qu'à bien se tenir. Les personnels de santé, avec ce vaccin, viennent de faire le plein d'énergie pour aller jusqu'au bout et surtout sortir victorieux.
Le ministre nous a montré le bon exemple. Donc je crois que sa réaction va vraiment amener tous les Camerounais à se faire vacciner contre le Covid.
Le lancement de la vaccination n'a pas eu lieu qu'à Orca, devenu l'annexe de l'hôpital central de Yaoundé dans la prise en charge des personnes atteintes. Le centre de prise en charge de l'hôpital gynéco-obstétrique et pédiatrique de Ngousso à Yaoundé aussi a injecté ses premiers volontaires avec le vaccin chinois Sinopharm. Bon à savoir, même vacciner, le respect des mesures barrières est recommandé. C'est seulement en adoptant une attitude responsable que le Cameroun pourra se débarrasser une bonne fois pour toutes du coronavirus.
Et la suite en religion. Pour une deuxième année consécutive, les musulmans du triangle national vont passer le ramadan à la maison et dans le strict respect des mesures barrières. Les activités autour du jeûne du mois de ramadan débutent donc ce mardi, traditionnellement marqué par des mobilisations familiales et religieuses. Au moment de la rupture du jeûne, le ramadan, cette année 2021, est à nouveau perturbé par la Covid-19. Selon les indications, le jeûne du ramadan qui s'achèvera par l'Aïd el-Fir, la fête de la rupture du jeûne, est fixée donc au 13 mai 2021. Avant cette date, les musulmans doivent s'abstenir de manger et de boire du lever au coucher du soleil. Je vous propose d'écouter rapidement El Hadj Aboubakar Bakok, président du Conseil des chefs musulmans littoral sud-ouest. Alors, je parlais tout à l'heure des mesures et bien sûr cette note du gouverneur de la région du littoral qui envisage des missions de contrôle inopinées dans son unité de commandement dans les prochains jours suite à la recrudescence des cas de Covid-19 de plus en plus observés dans la région ainsi que la hausse de la courbe des décès. Le gouverneur de la région du littoral, Samuel Dieudonné Ivara Dibo, appelle au respect des mesures barrières, des mesures de distanciation. C'est la substance d'un communiqué radio rendu public le lundi 12 avril 2021, le patron de la région demande aux leaders religieux, les présidents des syndicats des transports en commun urbains et interurbains, mais aussi les chefs traditionnels, les chefs d'entreprise, les responsables d'établissements scolaires de prendre toutes les dispositions à leur niveau et de veiller à l'application stricte des mesures de distanciation, du lavage des mains et du port systématique du masque dans leurs différentes communautés. Outre les missions de contrôle inopinées envisagées auprès des communautés cibles dans les prochains jours, indique Samuel Dieudonné Ivara Dibois, les autorités administratives et municipales ainsi que les responsables de tous les services administratifs privés et confessionnels sont tenus chacun de veiller au respect strict des présentes dispositions. Signé donc le gouverneur de la région du littoral. La suite de l'actualité, c'est avec vous, Henri Kedjan, et on s'intéresse justement au vaccin anti-Covid-19.
And thanks, Junior. Welcome back. Though some have been receiving the shots of the new COVID-19 Sinopharm vaccine coming from China, many Cameroonians are doubting Thomas's as far as the vaccines and the side effects are concerned. Now, what is this Sinopharm vaccine, which is actually, which the government rather says is a serious repost fortifier? Our Yaoundé Bureau Chief Correspondent Beatrice Ngamu attempts an answer.
Many persons, especially health personnel, frontline workers as far as the COVID-19 pandemic is concerned, have started receiving shots of the COVID-19 Sinopharm vaccine in Yaoundé.
So whoever is a healthcare provider, not necessarily working here, can come and be vaccinated here. When we complete that group, which was just about 19,000, but we have 200,000 vaccines available. We are going to the next step, which could be older people who are more vulnerable in this disease that we are talking about.
And these vaccines will be administered in 2 doses, and there is 21 days between each.
The Sinopharm vaccine, or BB1BF-CoV, works by teaching the immune system to make its antibodies against the SARS-CoV-2 coronavirus. With an effective rate at 76%, according to the state-owned company Sinopharm, this vaccine is being used in many other countries. Cameroonians are very indifferent as far as vaccines are concerned.
You can have a side effect, but those side effect is very, very minor and short-lasting. You can have headache as any other drug or any other vaccines.
They can't bring a vaccine without passing to the third trial. This third trial of this very vaccine has gone to several countries. So it's not a doubting vaccine. The vaccine that has its proof, that has its sensitivity and specificity.
The 200,000 doses of the Sinopharm vaccines have been dispatched all over the national territory. The Central region has received some 43,660 doses for the 45 centers and health facilities in the region. Worth mentioning that the Sinopharm vaccine is among the 4 vaccines Cameroon has commanded for its riposte strategy against the COVID-19 pandemic, with rising contamination and deaths.
Much Beatrice Ngamo, the World Health Organization Chief Scribe Dr. Tedros Ghebreyesus has said that the coronavirus pandemic is long from being over. The chief scribe of the organization added that the world has witnessed weeks of increasing cases and deaths, with last week being the highest number of cases in a single week. Now, Dr. Tedros Ghebreyesus has confirmed that vaccines are a vital and powerful tool against the coronavirus pandemic. Now, let's have a listen to Dr. Tedros Ghebreyesus.
Make no mistake, vaccines are a vital and powerful tool, but they are not the only tool. We say this day after day, week after week, and we will keep saying it. Physical distancing works, masks work, hand hygiene works, ventilation works, surveillance, testing, contact tracing, isolation, supportive quarantine, and compassionate care. They all work to stop infections and save lives. But confusion, complacency, and inconsistency in public health measures and their application are driving transmission and costing lives.
Tedros Ghebreyesus, the WHO scribe, prescribing barrier measures that need to be respected, hope it's gone through. Now, some Cameroonian students on scholarship in Algeria have embarked on a strike action over what they have described as a non-respect of the scholarship terms by the government of Cameroon. The irate students in Algeria have looked down on a monthly stipend that comes from the government in piecemeal. They say they have not received theirs, or a dime rather, for over 3 years now. Details with our Yaoundé Bureau correspondent, Hyson Chia.
It wasn't a friendly day at the Cameroonian embassy in Algiers, Algeria, as Cameroonian students on scholarship under the Ministry of Employment and Vocational Training stormed the embassy with placards and flags to express their dissatisfaction with regards to the management of their scholarship. Since 2017, our dues haven't been paid. We equally want to be paid the same amount of 75,000 francs as our higher education mates, instead of 50,000 francs. We have written several times to our ministry and the Prime Minister, yet no response. According to the disgruntled students, the government has practically abandoned them, subjecting them to untold hardship in the foreign land, especially during this period of the COVID-19. Life has become so difficult. Our parents are indebted. We do not have any funds to manage the COVID-19 pandemic. Their only hope, they say, is for the President of the Republic to come to their rescue as fast as possible.
Well, thanks very much, Hyson Chia. We hope that will be looked into. You say classes have effectively started in Cameroon, and this is the most decisive phase.
Et à Bafia, justement, les élèves de la ville ont donc repris le chemin de l'école hier lundi. Un trimestre qualifié de dernier virage pour ces élèves-là. Le reporter François Emossi et Espoir Baïra ont effectué des descentes dans plusieurs établissements scolaires de la ville de Bafia. Reportage.
Rentrée scolaire dans le respect des mesures barrières à Bafia. Dans les salles de classe du lycée bilingue, le port du masque est obligatoire. Élèves et enseignants prennent cette mesure à bras le corps.
Chez nous ici, le port du masque est systématique. On n'admet aucun élève dans l'enceinte de l'établissement sans son masque. Et bon, vous pouvez le voir un peu partout, les seaux avec robinet sont disponibles. Et également du savon pour que les enfants puissent se laver régulièrement les mains. Je crois qu'ils sont déjà habitués à cela et presque tous ceux qui oublient leur masque partent les chercher.
Au collège Sabaya, travail scolaire et protection contre le Covid-19 vont de pair. Ici également, le port du masque est obligatoire et le principal du collège s'attelle à faire respecter cette mesure et par tous les moyens pour une fin d'année scolaire sans Covid-19 dans le collège.
Se protéger, c'est protéger aussi son environnement, c'est protéger ses camarades, ses enseignants, le personnel administratif. Nous, on pense que si les choses se passent de cette manière, nous allons vraiment finir l'année scolaire sans difficulté majeure avec un corona hors de notre enceinte scolaire.
Dans les autres établissements scolaires de la ville, c'est le même mot d'ordre. Tout est donc parti, pourrait-on dire, pour une fin d'année scolaire sans Covid-19 dans les établissements scolaires de la ville de Bafia.
Et restons à Bafia, cette fois, rendons-nous plutôt dans les clubs de vin blanc. On parle de clubs de Matango. Les vendeurs et les consommateurs du vin de palme partagent au quotidien des moments particuliers autour d'un verre et loin des mesures barrières. François Emossi Espoir Baïra, une fois de plus.
Ils boivent à leur santé et le vin de palme est leur préférence.
J'aime le vin de palme, je peux consommer même un litre. Ça dépend des moyens que j'ai.
Le vin de palme, on le consomme, il n'a pas d'impact négatif sur l'organisme.
Dans les lieux de vente, le vin de palme se vend à 150 francs le demi-litre ou 300 francs le litre. Chaque consommateur de Noumpé y va selon ses moyens et prend son verre, loin du respect des mesures barrières contre le Covid-19. D'autres encore très inspirés lui confèrent des vertus.
Lorsqu'on nous voit en train de boire le matango, on trouve qu'on est du bas peuple, quoi. Pourtant, c'est notre vin à nous, Africains. Jadis, nos mamans, lorsqu'ils laissaient les petits bébés à la maison, on les laissait du matango. Parce que le lait maternel n'était pas facile à conserver. Et on faisait consommer ce matango aux bébés qui restaient.
À chaque vendeur, sa méthode de ravitaillement. Et chacun traîne derrière lui plusieurs années d'activité.
En 2012, j'ai commencé l'activité du vin de palme. Ce qui fait que, bon, moi j'ai mes recueilleurs en douce. J'habite ici en ville. Je me lève chez moi à partir de 5h30 parce que je suis partout, 7 km chaque matin pour aller chercher du bon jus.
J'ai commencé là au début, ça me payait. J'avais au moins ça me dit dans le temps. Bon, maintenant, ça ne paye plus comme c'était.
Entre consommateurs, on se passe le même verre, malgré le nettoyage des divers par les vendeurs avant service du précieux liquide. Il n'est pas exclu que dans cette méthode de consommation, au lieu de boire à la santé, qu'on se retrouve à boire un Noumpé contaminé par une maladie, notamment le coronavirus.
Et nous sommes suivis en direct sur notre page Facebook Canal 2 International ou bien sûr en direct sur notre compte YouTube Canal 2 International. Et on poursuit avec vous Henri Kédian, la rentrée scolaire.
And classes have effectively resumed for the third term amid scare of possible contamination of children with barrier measures. If barrier measures rather are not respected, head teachers are already complaining of the challenges they are facing on a daily basis to ensure that all the children wear their mask. Though they have been doing everything to make sure the children put this mask and even providing masks to some of these children who can afford or who must have forgotten their mask. They say it has not been very easy. Maureen crisscrossed some of these schools in Cameroon's economic capital, and that's what she brought back.
It's break time and pupils are relaxing with mates after hours of study in the early hours of the morning. Monday, April 12 marks the official resumption of classes for the third term, described as most decisive. Classes are effective, but for the scare of COVID-19. At the level of the primary, buckets filled with water and soap are made available, but a major problem is seeing the pupils putting on face masks in the course of learning.
As you can see, we have our buckets to wash our hands, or the children to wash their hands. They have their masks on, and they have their sanitizers and anything that we need for the COVID-19 to prevent it. We go there every time and remind them every morning, and those who have forgotten their masks, we have them in the coffers, and we begin to give them one by one. Every time, when one is not having, we make sure that we give them.
In this classroom, for example, some pupils could be seen studying without face mask. Teachers complain of tight classrooms, thus preventing the children from systematically putting on their face mask.
As they came back today, we started by telling them, man is prone to forget. We knew that they forgot. But when they came today, we joined them together and we tell them anew as if we have not told them before. And we told them what to have to do. And every day, that is what our duty to do it every day.
In this secondary school, measures have been taken to contain the spread of COVID-19. Ceiling fans have been placed in classrooms to enable the children breathe well in their face mask. Head teachers and principals say they will keep a close eye on discipline to ensure the children improve on their studies.
Indeed, thanks very much. Farmers in the southwest region of the country are battling with insecurity and climate change. Irregular rainfall triggered by climate change is causing a toll on agriculture, and farmers have been advised to make sure they go for drought-resistant seedlings in order to minimize the effect of climate change. Reginald K. Tandart.
At 10, little Lucy already understands why she needs to assist her mother in the farm. Raised in the 4-year-long armed conflict in Anglophone Cameroon, the need to till the soil has become even more important for Lucy as well as these farmers, as livelihoods have been threatened. Some farmers have abandoned their farms as a result of insecurity.
I have a farm somewhere that I will not go there alone because you are afraid of unknown incident.
Aside from the conflict, farmers here in Ombe, a small locality in the Fako division of the Southwest region, are grappling with the effects of climate change.
At first, they rely on that 15. The way 15.
At first, our parents used to rely on March 15 to plant when rains fall. But today, the weather has become unpredictable. For instance, this year, rain fell in March. But this is April and there is so much heat in the soil. Now, if you look at the crops behind me, like the maize and the egusi, they are not doing well.
Some experts have attributed the changing climate to man's actions over the years.
The influence of man on the environment has caused a change in the climate, and which is usually reflected by a change in the pattern of rainfall. Rainfall patterns have changed and the rains are coming later than they used to come, and at times they are not well distributed.
Farmers here rely 100% on rain-fed agriculture.
Without water, the plant cannot produce. The seed cannot germinate, the plant cannot sprout.
But irregular rainfall has left farmers confused.
This year, the rain don't come.
This year, the rains have fallen just about 4 times, but not very much. Even as we continue planting, you realize when you till the soil, it is whitish, indicating the rains didn't penetrate the soil.
Faced with this situation, farmers have been advised on how to adapt, even though the measures are expensive for an average farmer.
What we do now is to sensitize our farmers to use drought-resistant varieties of seeds. If they plant drought-resistant varieties, if there are no rains, the plant can resist. They should also use insect-resistant variety greenhouse techniques.
The farmers here in Ombe are appealing to government and goodwill persons for assistance, as farming remains their last hope in the face of a 4-year-long armed conflict.
Well, thanks very much, Regina. Now we swing over to the central region where pupils of the government primary school in Tui and Munatili are in tears after wild winds destroyed their buildings at the eve of the back to school or resumption of classes for the 3rd term. Now the strong winds completely unroofed the schools, leaving the children and families homeless. Ndimori.
Unlike their mates who received lessons on the first day of another decisive term, those of government primary school, the Sombe in Tui and Monatele too, could not do same, reason being their school has been destroyed by violent wind. Teachers, parents, as well as pupils are in shock. They are helpless in the face of the situation. In the night of Thursday, we were hit by violent wind, which completely brought down the school. The head teacher, Andre Mugnol, is frustrated with the present state of the school. The strong winds has deprived the children of what they cherish most, which is education. The dilapidating state of the school, built in clapboards days back, had attracted administrative authorities. Together with the teachers, they brainstormed ways of reconstructing and rebranding. But its destruction by strong winds, many say, is a clarion call for government to put up a befitting structure in order to facilitate learning for the pupils. Created in 1998, the school has no toilet, no chairs for teachers, and benches for the pupils. Some are forced to squat on the ground. Getting potable water on campus is a nightmare. We want government to come to our aid. The council has been doing their best. A technician was here some days back, and he gave us hope that things will be back to normal. While waiting for the school to be reconstructed, the head teacher announced soliciting for other public spaces where the children could continue learning. It should be noted, the violent wind equally left 6 families homeless.
Well, thanks very much, Maureen. Do you hope by 2025 that vision will be realized or achieved? That particular report brings us to the end of this bilingual edition of the 1 p.m. News and Canal International, in which you got news on how vaccines are a vital and powerful tool to prevent the coronavirus pandemic, coming from Dr. Tedros Ghebreyesus, the WHO scribe, and of course the death of one of Cameroon's leading medic, Professor Kaptwi Lazar, who died last night. From all of us, it's goodbye from me, Kejang Henry Atembe, and Junior Hussein. Goodbye, Junior.
Goodbye Henri Kédian. Merci donc à tous d'avoir regardé le 13h sur Canal 2 International. Je vous le rappelle, nous sommes également en direct sur notre page Facebook. Vous tapez Canal 2 International, ou également en direct sur notre compte YouTube. Vous tapez Canal 2 International. Ne manquez pas donc le 19h50 avec Michael Tiptio sur cette antenne. Et bien sûr, sur nos comptes Facebook, YouTube. À très bientôt.
Thank you.